So this is chapter 53, the assessment of the endocrine system. And throughout this chapter, you guys will see we're really just going to focus on your anatomy and physiology. Take a think, what is the function of the endocrine system? The endocrine system secretes hormones that help maintain homeostasis through processes like controlling fluid and electrolyte balance and glucose regulation. Use your book and take a few minutes to go ahead and write down as many organs or glands you can find that are a part of the endocrine system. And go ahead and think which hormones are associated with which glands. This is something that you need to learn and understand because it's going to help you in later chapters. You'll find that endocrine glands are located throughout the body. They're going to affect all other body systems, and their target tissues may not be near the gland location. Hormones are secreted into the bloodstream for transmission to target tissues, causing these tissues to change their activity. These glands include the adrenal glands, the gonads, such as the ovaries and testes, the hypothalamus, the pancreas, the parathyroid, the pineal gland, the pituitary gland, the thymus, which is also a part of the lymphatic system and it functions best as a child, and finally the thyroid. The hormones for each of these can be found in box 53.1. Image shows the location of the endocrine glands. It's located on page 1290. Whenever you look at this, I want you to understand that there is no direct anatomic connection between glands and their target tissues. Start with the thyroid and parathyroid gland. So landmarks are going to help with the palpation and identification of the thyroid gland. Box 53.2 has the function of thyroid hormones. T3, T4, and calcitonin are the hormones that are produced by the thyroid. T3 and T4 are controlled by a negative feedback system. And I want you guys to really hone in on that negative feedback system because it's really going to explain how your thyroid gland works and it's going to show how your parathyroid gland works. So a negative feedback system in the endocrine system is the body's way of keeping hormone levels stable and balanced. In this process, when the level of a certain hormone in the blood gets too high, the body sends signals to slow down or stop its production. On the other hand, if a hormone level drops too low, the body signals for more to be released. So let's think about the thyroid gland. So when the thyroid hormone levels rise too high, the pituitary gland is going to sense this and it's going to reduce the release of thyroid stimulating hormone, that's TSH. So with less TSH, the thyroid is going to make less hormone, which is great because remember it was just high. And that's going to bring the levels back down. If the thyroid hormone levels get too low, the pituitary does the opposite. It says, hey, these levels are low, we need to stimulate that thyroid. So it's going to make more TSH to tell the thyroid to produce more. This constant balancing act helps the body maintain homeostasis, meaning a stable internal environment. Negative feedback is important because it prevents overproduction or underproduction of hormones, both of which can cause health problems. Rounding back to our thyroid hormones, T3 and T4 control the metabolism. Both increase the metabolism, causing an increase in oxygen use and heat production. So think if your T3 and T4 levels are off, it's going to affect your metabolism, which can make you hot or cold depending on which way you're swinging. Or it can make you have that high metabolism we all wish we had when we were younger. You could have a high metabolism and it could cause you to digest food quicker. Or you could have a low metabolism and you might hold on to it, and that's where we might see more systemic effects. So calcitonin is the other hormone in the thyroid, and it is going to lower the calcium and phosphorus levels by reducing the release of these minerals. Low calcium levels suppress calcitonin secretion, and elevated levels increase its secretion. Moving on to our parathyroid glands. So those parathyroid glands are 4 small glands close to or within the back surface of the thyroid. They're going to secrete parathyroid hormone, which regulates calcium and phosphorus metabolism by increasing bone resorption or the release of calcium, and this is going to increase the serum calcium, that's the overall calcium levels in your blood. These hormones are also going to activate vitamin D in the kidneys, and they are going to increase reabsorption of calcium into the blood. The calcium level determines the parathyroid hormone secretion. So if we have low calcium, we're going to have increased parathyroid hormone activity because that parathyroid is saying, hey, our calcium is low. I'm going to release more hormones so we can go ahead and get that calcium up. Parathyroid hormones and calcitonin work together to maintain your overall serum calcium levels. Moving on to the adrenal glands. These are going to be the vascular tent-shaped organs on top of each kidney. Your adrenal glands are going to produce three main things. The first is going to be mineralocorticoids, mainly being aldosterone. These are going to control fluid and electrolytes. So aldosterone maintains extracellular fluid volume and electrolyte composition. It promotes sodium and water reabsorption and potassium excretion in the kidneys. Secretion is regulated by the RAAS, serum potassium level, and adrenocorticotropic hormone. Next, we have the glucocorticoids, which are essential for life. The main one is cortisol, which is responsible for stress-responsive, carb, fat, protein metabolism, emotional stability, immune function, fluid and electrolyte balance of sodium, and it must be present for catecholamines, which are epinephrine and norepinephrine, to work. Finally, for catecholamines, the release is caused by the stimulation of the sympathetic nervous system. Catecholamines are secreted in small amounts to maintain homeostasis, and stress triggers increased release, causing a fight or flight response. Your main catecholamines are going to be your epinephrine and your norepinephrine. Forward, we have the gonads. So for males, we will have testes, and for females, we will have ovaries. These hormones are dormant until puberty. Secretion of these hormones trigger the development of secondary sexual characteristics. And we will actually discuss this more in chapter 61 over the reproductive system. Next, we have the hypothalamus and the pituitary glands. And we're going to talk about these together because they work together. So your hypothalamus produces regulatory hormones that travel to the anterior pituitary, and that's going to trigger the release or inhibit the pituitary's hormones. So the body has something going on, and the hypothalamus says, hey, we need to make more of this hormone. So it's going to send the signal to the pituitary gland, and the pituitary gland is actually going to be the one that releases those hormones based on what the hypothalamus says. So the pituitary gland is split into an anterior and posterior part. The anterior pituitary has hormones that work on other endocrine glands called tropic or trophic hormones, and other hormones like prolactin that work directly on their target tissues. Remember, these will release based on the signals that they are getting from the hypothalamus. The posterior pituitary, however, will actually just store the hormones that it receives from the hypothalamus. So it stores oxytocin and vasopressin, aka the antidiuretic hormone. And remember, the antidiuretic hormone promotes water reabsorption. And so they are produced in the hypothalamus and they will be stored in the posterior pituitary gland. And we have the pineal gland. And this little guy is just the size of a grain of rice. It is at the base of the brain. And the pineal gland is going to secrete melatonin when it's dark, therefore assisting in the circadian rhythm and the sleep-wake cycle. Moving forward to the pancreas. So, if you have ever taken care of someone who has diabetes or you have diabetes, it's very likely that the pancreas here is going to be your culprit. So your pancreas has exocrine and endocrine functions. Those exocrine functions are included with the secretion of digestive enzymes. But we are focusing on the endocrine system right now, so let's focus on those endocrine functions. These functions are going to be made up of three cell types, the alpha, the beta, and the delta. So those alpha cells are going to secrete glucagon and increase blood sugar. The beta cells are going to secrete insulin and lower blood sugar by increasing glucose movement across the cell membrane. And that delta cell is going to secrete somatostatin. Once again, that is somatostatin, and that is going to inhibit release of several hormones for regulation. Now that we have discussed all of the glands, let's go ahead and look at what we are going to assess as nurses. As always, we're going to start off with the patient history. We are going to collect the age, sex assigned at birth, the age of onset of menses, when menopause began, and any use of exogenous hormones. We are going to assess nutrition. GI changes can be associated with endocrine issues such as excessive thirst or hunger. Iodine is needed to produce thyroid hormones, but it's not produced by the body, so it must be consumed. So ask about the intake of iodine sources such as dairy, eggs, iodized table salt, seaweed, or shellfish. Assess for family history of diabetes, obesity, growth or development issues, infertility, or thyroid disorders, as these can be related to genetics. And finally, box 53.4 has interview questions for these patients. Physical features can be changed due to the effects on growth and development, electrolyte and fluid imbalance, sex hormones, and metabolism. Upon inspection, observe the general appearance such as height, weight, fat distribution, and muscle mass, and see if it's appropriate for the age. Assess the scalp and body hair. Look for any abnormal facial features such as moon face, a long prominent forehead or jaw, a dull or flat expression, or exophthalmos, which is the protruding eyeballs. Look for visible enlargement of the thyroid. For skin, look at the color for hypo or hyperpigmentation. Look at that skin for infections, for slowed healing or easy bruising. Assess the nails for brittleness. Assess the trunk size for chest size and symmetry, for a buffalo hump, or for breasts in men. Upon auscultation, listen to the heart rate and rhythm for a baseline because some endocrine disorders can cause dysrhythmias. Bruits can also be heard over the enlarged thyroid. For palpation, the thyroid and testes can be examined by palpation. And think about how you're going to palpate that thyroid. So if you haven't already seen it in your book, you're actually going to stand behind the patient and you are going to reach around and feel their thyroid from behind them. You're going to have them tilt their chin down and take sips of water while you palpate. Remember that endocrine disorders affect hormones, and those can change a patient's behaviors, personality, and self-image. Assess coping mechanisms with these changes and their support system. Ask about their change in stress response, the frequency of crying, or the degree of patience and anger expression. Their self-image can be greatly affected due to body changes, infertility, or impotence that endocrine disorders can cause. For diagnostic assessments for our laboratory tests, these are going to start in your textbook on page 1299, and you guys can review your laboratory test on your own. For your imaging assessment, though, I do want to say that the skull x-rays can show abnormal growth of the pituitary gland, and an MRI with contrast is the most sensitive way to view the pituitary gland. A CT can be used to view the adrenal glands, ovaries, and pancreas, and ultrasounds are often used to view the thyroid, the parathyroid, ovaries, and testes. For other diagnostic assessments, an ultrasound-guided needle aspiration of the thyroid can indicate composition of the thyroid nodules and determine if surgery is actually necessary. Moving on to our audience response system questions. 1. Which nursing assessment is the priority when caring for a client with primary adrenal cortex dysfunction? You guys can take a moment to review your answer choices. You can pause your video here, and we will discuss the answer on the next slide. So the answer here is going to be D as in Delta. So assessing the physiologic response to stress is appropriate as cortisol affects the body's stress response. All other assessments can then be completed. Read this question and review your answer choices. Remember that this is a select all that applies. So you can choose your answer choices and pause your video here, and I will answer your question on the next slide. The answers here are going to be A, B, C, and E. So changes in physical appearance can reflect an endocrine problem. Obvious changes identified during the physical assessment include hair texture and distribution, facial contours and eye protrusion, voice quality, body proportions, and secondary sexual characteristics. Changes in weight and fatigue may also be associated with endocrine disorders as well as other conditions. Poor peripheral pulses are more likely associated with a cardiovascular disease. question, so go ahead and take a moment to review it and review your answer choices. You can choose an answer and pause your video here, and we will review it on the next slide. The answer to this question is A as in alpha. Dilute urine and dehydration are symptoms that result from an age-related decrease in antidiuretic hormone. The other symptoms listed are not related to age. So that is it for chapter 53. If you guys have any questions, please feel free to reach out to me or whoever your instructor is. As you know, we are always here to help, and good luck on your test.